I know the course talks about nursing informatics, but I thought we need to expand it a bit to talk about health informatics and other emerging issues in healthcare. So health informatics basically is an interdisciplinary study of design, development, and application of IT-based innovation in healthcare service delivery, management, and planning. And that's according to Proctor. As one of us has told us, we have a lot of information which comes from diagnostic and patient record. How do we use that information to improve patient outcome? And it means we'll have to reorganize our knowledge, our skills, to ensure that we don't just use computers for the sake of it, or ICT in healthcare. We use it for a purpose. And so health informatics has been defined also as the science that studies the use and processing of data, information, and knowledge, and it's applied to medicine, healthcare, and public health. So anytime we talk about data, information, and knowledge, it means we need to be keen about those few terms. And I want to believe in our research, we talked about data, facts about phenomena, about issues. And when we process or manipulate that data, then it tells us something. So it gives us information. When we have information, then we have knowledge. When we apply that knowledge, then it leads us to wisdom. And when we apply that wisdom, then we are able to end up with safer society and communities. So if we are going to apply data, information, and knowledge, what are some of the disciplines would expect to work in collaboration? So when we look at the objectives of health informatics and the overall vision of it, it means that we need to collaborate with a number of disciplines. So other disciplines involved in health informatics include computer science, information science, social science, behavioral science, management science, and others, including public health, as one of us has said. So health informatics basically use tools or borrow tools from computers, clinical guidelines, formal medical terminologies, information and communication systems. That basically helps us define the scope of health informatics and the significance of it. When we talk about resources access using health informatics, we not only talk about clinical guidelines, we also talk about standards of practice, the policies and procedure manuals, the research findings, the drug databases, information on community resources. And IT helps ensure that we have access to the most recent versions of these types of resources. And if we are going to access all these resources, then it means we need to have standardized language which we apply in health informatics. Because we need standardized language, then there's importance of developing formal medical terminologies. Initially, these are clinical vocabularies, terminologies, and coding systems which are structured as a list, and they bring together definitions, and that those definitions are what are used to design and describe specific clinical vocabularies and terminologies that will bring reduction of ambiguity. And as long as we have a common language, then we'll be able to better design, plan for care and treatment of patients. Let me stop there and ask us whether there is any medical vocabulary or terminologies which we have had or which we have applied in our practice. We do agree that those codes are developed by different international bodies, and we'll be able to give you as a resource material to go through those. So if we are talking about ICT and emerging technologies, how do we apply them in healthcare? And remember, this is very categorical. I'm just not talking about nursing informatics alone. I'm talking about healthcare. So we're going to use the next few minutes to look at emerging technologies, their use and impact on healthcare delivery and management. And to start looking at something very simple, starting with telehealth and telemedicine. Now, the two have been used interchangeably, but there's a slight difference. Telehealth is the delivery of health-related services and information via telecommunication technologies, while telemedicine has the same component but has a therapeutic effect or treatment impact added to it. So telehealth, basically, we use communication information technology to deliver health and healthcare services, information and education where participants are separated. There has to be some geographical separation between two people for us to say we are talking of telehealth. So if we are talking about geographical separation or geographical gap, then it means telehealth can be used to improve access by overcoming barriers of geography, including transportation infrastructure, socioeconomic disparities. Telehealth enables clinical consultation, continuing professional education, like what we are doing today, health promotion, healthcare management, and administration. We have both broad and low bandwidth infrastructure and technology used to provide services. Let me take a moment and ask us to share our experiences in telehealth. We want us to share any experience we've had in consulting online. Have you had any of these services at a personal level? So most of us have had all those experiences. Either you had a continuing education session, or you had online consultation, or probably you did ordering online, and all those are different ways of using technology. So telehealth could be as simple as two healthcare professionals discussing a case over the phone, or as sophisticated as using video conferencing to communicate between two provider facilities in two different countries. It could be as complex as robotic technology, robotic care, robotic surgery, such things. So basically, while telehealth is an expansion of telemedicine basically focuses on the curative aspect. But telehealth goes beyond, and it encompasses preventive, promotion, and as well as curative aspects. Originally, it was used to describe administrative or educational functions related to telemedicine. Today, it has gone beyond that and encompasses technological solutions. Simple things as use of emails to communicate with patients, ordering of drugs, providing other health services, as we shall see. So telehealth can be looked at as suggested as providing both clinical and non-clinical services. So we want to take a moment and look at some of the clinical use of telehealth technologies, and we'll look at them in details. For now, we'll look at clinical use of telehealth technology. Clinical use basically means it's anything which when shared will be used to have an impact of direct patient or client care. When we do transmission of medical images for diagnosis, when you do group or individual exchange of health services or education via video conferencing, and we'll be talking about real-time and store and forward modes in a moment. When we talk about transmission of medical data for diagnosis or disease management, when we look at advice on prevention of disease and promotion of good health by patient monitoring and follow-up, as well as health advice by telephone, otherwise called teletriaging, then we'll be talking about use of telehealth in clinical work. We also have non-clinical use of telehealth technologies. Maybe that is what we are more familiar with. What we are doing now, we are doing education. We are having a lecture. So distance education, including medical education, grad routes, patient education, all those are non-clinical use of telehealth technologies. Administrative work, meeting among healthcare workers, supervisors. When you'll be doing your presentations for your research, we'll be doing non-clinical use of telehealth technologies. Online information and health data management, healthcare systems integration, asset identification, listing of patients, documenting patients' movement, and overall healthcare system management are some of the non-clinical uses of technologies. Now, whether we are using telehealth technologies for clinical or non-clinical, we have three main modes we work with. One is store and forward. Then we have real-time telehealth and remote monitoring. As there has been suggested, I'll ask one of us to guess what store and forward is. So the store and forward telehealth basically means we have digital images, video, audios, and all forms of clinical data that are captured. First, they are captured and then they are stored. That means they are saved somewhere. It could be on the client's computer or on the hospital computer, and then at a convenient time, they are transferred or transmitted securely. That means being forwarded to a clinic at another location or another health institution, or you're probably forwarding them to a specialist, or you're forwarding them to somebody else for their opinion. Once that opinion is recorded, then it is transmitted back to the source. And then it means the information does a round trip. It could take 2 minutes, it could take 48 hours, or whatever period of time which has been set. More often than not, store and forward is done by specialists. Cardiologists, radiologists, dermatologists, all those. And we only do store and forward when we are not in critical setting, when do not require the information very urgently. So dermatologists, radiologists, pathologists, some of those may actually be more in practice of store and forward. In serious conditions, we do real-time telehealth. There is instantaneous interaction. One of the technologies we use in instantaneous interaction is video conferencing. when we use peripheral devices that are attached to a computer and allow real-time interactive examination, then we talk of real-time telehealth. Now, the technologies now are available which are better, which are cheaper, and allow real-time audio or video streaming, and that more often than not leads to lower cost. Supposing you had a patient in Northeastern, right now it could be flooding in Northeastern, and you needed to review a patient's skin condition, or you needed to review you needed to do a physical examination of a patient. You could tell them either to travel all the way, take a flight, or you could link them up with an health institution which has telecommunication, and you'd tell them you want to view the patient. You probably work with a nurse on the other end who can do head-to-toe examinations as you view, as you watch. You could also decide to monitor or to connect that patient on an ECG machine if you're interested in checking the vascular system, and you watch as they do it, and you get real readings transmitted to you. You can imagine how much time you'd save the patient, you'd save them the cost of travel, and you can imagine many other benefits both to you and to that patient. So, real-time telehealth include telemental health, telerehabilitation, telecardiology, neurology, nursing, and many others. On the other hand, remote monitoring uses sensors, and those sensors are used to capture and transmit biometric data real time. If you have a tele ECG which is monitoring a patient in a specialized area or in a remote area, or electric activities, brain activity, it could be done real time, where you have your own terminal which is receiving information on the devices connected to the patient, or you could decide to get that information recorded for a period of time and forwarded so frequently. Maybe you receive information from a patient who has a sensor every 30 minutes or every 2 hours. So remote monitoring could be real time, or it could be store and forward. Some of the situations or conditions which we can easily do remote monitoring include home-based nocturnal dialysis. I know we have not reached that in Kenya yet, but we'll be reaching there soon, I believe. Cardiac and multi-parameter monitoring of remote ICUs, home telehealth, and many other disease management strategies which are done using terminals. What are some of the benefits of telehealth? I'll ask us to think through. Satisfaction, quality improvement, saves space, and of course, among others. We'll classify them into two for ease of discussion. So we have e-health, which you're talking about, the health informatics, and we've gone through all that in details, including reducing the time of consultation. But I want to focus on something called you're doing it for a fee. If you go to Ponea, I think Ponea is the latest baby entrance in Kenya, you can be able to pay for a specialists to come and see you at home or be seen online. We do that through the World Wide Web, which has been a revolutionizing phenomena or innovation in both education and information. So, when we move together professionals and we use whatever information they have or we seek their services for pay, then we'll be talking about e-commerce. When you pay for something on M-Pesa, you're doing e-commerce, electronic commerce. When you pay on PayPal, when you use cryptocurrency to pay, all that is e-health. But most important, commerce and e-health has contributed to the changing behavior of health professionals, personnel, citizens, and the patient in general. And because e-health has brought new challenges, then we need to think of regulatory mechanisms on how to ensure that the patients or clients are safe in the e-health and e-commerce space. So we have to think of how to connect globally with the aim of improving healthcare as well as increasing safety of the clients. And along the way, we'll be looking at some of the legal mechanisms which have been put to secure both the patient and the healthcare provider. Other emerging issues which have come up in e-health is the issue of security and terrorism. Remember, terrorism is not just about physical, it's about online bullying, it's about online terrorism. If you're going to put your credit card details, for example, to pay for a health service and you meet somebody decided to wipe out your funds, what happens? We also have national governance and policy issues which have been put in place. We have the role of insurance, among others. So insurance will bring the challenges of having paid fake claims or catering for people who are actually not insured by them. And so we have biometrics which have been brought in as technology to improve some of those issues. So telehealth has brought up many issues, both positive and negative, intended and unintended consequences. But one thing we do agree for sure is that there has been behavior and cultural change as a result of use of technology in healthcare. Talking a bit about use of technology to deal with security, I don't know how many of us are familiar with blockchain technology and what it's all about. I'll ask somebody to share their experiences. Now, blockchain technology, as we have said, basically develops permanent, immutable records which are verified across the globe. That information is not only shared by you, it is actually shared by many others. And every time you do a slight change in any of those code, then it is shared all over by anyone who has been given information to verify. Now, I will not go to the details of it, but I've given you a paper to review. I've sent you a link. I want you to go and review those two papers and just learn more on how blockchain technology has been used in healthcare. The other thing I want you to go and read further on is the medical coding and classification system. I've also given you a link to a document you can read further on. On assignment of the day, this is not actually assignment of the day, it is assignment of the course of the week. I don't know how many of us are familiar with Coursera. So you'll go to Coursera online, that is the link. You can pay for the course or you can apply for financial aid, and because of time I will expect you to upload the certificate of completion by the end of January 2023. The submission link will be put on HNS 402 portal. That completion certificate will cater for the requirements of both the course HNS 402 and HNS 401. That completion certificate will contribute to 5 marks of your CAT. So if you complete that certificate, you'd have already earned 5 out of 30 marks for your CAT. So thank you.